and what really to achieve that. So we develop resources and tools that help activate the rare disease community, and we do that collaboratively by helping to build a global connected web network, build upon collaboration and model for success. And we also work to fund science and technology and other innovations through partnerships that help broadly impact patients within our lifetime. So we do really here at Global Genes, and if you could advance to the next slide, please. Efforts to educate the community and build awareness. We do this again by developing resources and tools such as toolkits, interactive webinars, and other education programming that help build a successful disease activist for their community. We know that within the rare disease community, we have so much in common with one another as we strive to raise awareness, encourage research and development, and investment into innovative treatments and solutions for the rare disease community and the diseases that we're all working with individually. We work to collaborate and build that connected network so that we have a chance to build upon case studies and share with one another what's been successful as we strive to make a difference with the communities that each one of our Foundation Alliance partners are serving. And we strive to foster innovation by building upon that connected network and formulating innovative partnerships that bring information and value and connectiveness and resources to our disease community. We also today want to take a few minutes to touch upon our Foundation Alliance. Again, we know that with the action of this new Rare Patient Impact Grant Program, we've gotten a lot of interest in a lot of new members who are joining us on Foundation Alliance membership, and we are enthusiastic and grateful to see that level of participation and interest here at Global Genes. And so we thought today we'd take a few minutes to just talk a little bit about what Foundation Alliance is. In order to do that, I'd like to turn the program over to Carrie Austria, our Advocacy Manager.
Next slide, please. Now, Foundation Alliance is a program that we created actually a few years ago because we truly believe in that collaboration is the heart of the success of the rare disease community. Working together, sharing our strengths, and helping those who are stronger in various facets of the rare disease community, whether it's marketing or research or working with academia, be able to pair them and kind of bridge the gap with others who are starting out, a little bit farther down in their journey, trying to get a little bit more support for what they're working on. We really built the Foundation Alliance to group together nonprofit organizations and support groups to just come together for that collective voice. For those of you that have been a part of the Foundation Alliance for the last few years, this is a program that we have so desperately wanted to give you, and thank goodness for the development of our advocacy team. We are finally, 2016 is going to be such an exciting year for this program. So I appreciate the patience of our older members who have been along with us for the ride, watching us grow. And we've got so many exciting things in store for you for 2016 with this program. Now, the goal of the Foundation Alliance is really to come together to, face what's going on in the rare disease world today. With over 7,000 rare diseases, there is so much connectivity in many disease groups. They could have similar symptoms. They could have similar disease progression. They can have similar research focus. And our goal is really to provide you, as Kim said, the educational tools and resources to take that next step, to be able to be your support for whatever direction you are looking to go with your organization. And also to share best practices with others who've been there before you. We are, this group here, those of you on the call, those of you rare disease who are not able to be on the call but will be viewing this later, you are the heart of future research, of future awareness, and future education for this community. So it's really important for us to really just come together and work together towards that goal. And this, as Kim said, our mission is to eliminate the challenges of rare disease globally. And this is one of the ways that we really will have an incredible impact in 2016 moving forward. Next slide, please. What do we have in store for you for 2016? Definitely a much more structured program. It's going to be very exciting, and we really encourage the participation of foundation leaders to join us. We'll be creating committees with the Foundation Alliance to work on various projects. The rare disease community as a whole needs. It's not going to be disease specific, but it will definitely affect the entire disease community. And when this program gets launched, we really encourage all of you to share with us where your strengths are, what you're passionate about, and come work with us, to provide this to the entire rare disease community. We'll also be using the Foundation Alliance to find out what's important in the rare disease community. There's so much work to be done. But like many of you, Global Genes only has so much capacity to get it done. So we want to know what is needed now, what can we provide the most value to all of you in the rare disease community. We also plan to provide experts to you, whether it be on nonprofit development, research. We're going to have special member-only webinars to help you grow. The stronger each of you and your foundation and support groups are, the stronger our rare disease community will be. It's kind of our way of just more education, more support, more strategic experts your way so you can be stronger. And we'll have quarterly webinars. We'll be bringing that again for our longer-term Foundation Alliance partners. We're going to be asking some of our foundation leaders to share some of their best practices with you. Whether it's social media or fundraising or drug development, we want to share their expertise and what they've learned so that you can get that education and also so you can avoid some of the pitfalls they may have experienced when we're going through this. Right? Next slide, Amanda.
There it goes. There it goes.
Perfect. Thank you. And a lot of the questions we get asked regarding the Foundation Alliance is, as a foundation partner, what do you expect from us? The answer is simple, is to work with us. Collaborate with us on what we're working on to help the rare disease community. It could be participation in webinars, toolkits that we're putting out. Whatever your expertise is, we'd love for you to share that with us so we can share it with the rest of the Foundation Alliance, the rest of the rare disease community. We'll be putting together some campaigns like our Denim Dash, our second annual, is going to be coming back, and Amanda will briefly touch on that later. Just programs that we put together we would love for you to be a part of. Everything we ask of you is going to help your community directly. Because, again, working together is how we make the biggest impact. There are no membership dues. There will be a lot of benefits. The first one is being able to participate in this Rare Impact Grant Program, which our team is so excited about because we know that this will directly impact the community that each of you are working for. It will also give you priority registration at our Rare Patient Advocacy Summit next year, September 22nd, 23rd, for those of you who are already planning to join us. It is a sold-out event each year, and we definitely want to make sure our Foundation Alliance partners are able to join us, whether it's live stream or in person, to be able to receive all the information that we're able to share and all the experts that we're able to bring in. And also, we have a lot of promotional opportunities for you. We want to know what events you're putting out. We want to know what research successes you've had so we can share them in our Rare Daily or our Rarecast podcast. So we have there's so much that we can do to work together, and the goal of the Foundation Alliance is just to bring that together in a way where we can really make a huge impact in the rare disease community. With that, I'm going to pass this back over to Amanda, who's going to tell a little bit about the grant program.
Thank you, Kim. I really appreciate that. I think it gives a good sense of how this Rare Patient Impact Grant Program really fits into the greater community of the rare disease community and really fits into the family of Global Genes and how we really want to lift our Foundation Alliance partners up, as well as support groups that are just starting off so that they can really have the capacity to grow and move and support their individual disease communities. So now we're going to get into the grant overview, and a lot of the questions that have been filtering in over the last several weeks. I'd really appreciate all the questions and diligence that this community has given to this program. I think it's something that's definitely needed, and we're getting great responses. So again, ask questions. You can ask them throughout the program using the Q&A section, and then go ahead and just select Global Genes as the recipient for that question, and we'll either answer it right on the call today, or if it needs more discussion or pull through, we will definitely be following back up, and I'll get to that at the end of the presentation today. So dive right in, the grant overview. So really the goal of the Rare Patient Impact Grant Program is to award programs and projects that really will make a tangible and identifiable effect on the rare disease patients and families. You know, what can really make impact in the 2016 year that, you know, can range between $500 all the way up to $50,000. You know, we know that a lot of the activities that you're working on just need a little bit of support to really make a huge impact. So that's what we want to really do with this grant program. What kind of projects do we fund, or will we look at funding? You know, there's a lot of things here. There's even more in the grant guidance document that gives you a little idea of what we will fund. One of the big things we will not fund will be research and then personal requests, so individual types of requests versus family activity weekends and respite care for or respite breaks for caregivers. These are the type of programs that we know will really make an impact, but this particular program will not be funding research. We know that there's great things happening around research already, and we really want this to focus on the patient community and what, you know, we all hear is really needed in the community on the ground to support the projects you're already working on, or things that you really just want to start and haven't really had the capacity to do. We want to help support those. The source of funding, Carrie had talked about the Denim Dash. So that, along with our Tribute to Champions of Hope event and a couple other events that we do throughout the year, is really funding this direct appeal for the grant funding. So we want to, again, put and invest money into the programs that our community needs. And this is one place where we really identified as the need being. So again, we're going to be continuing to accept donations and funding through the end of the year, which will help determine how many grants we can give out for this round and then for future funding. It'll really depend on the type of grant proposals we get and the funding that's available. So again, we appreciate all the support. If there's any partners from our corporate alliance that help support this type of program. It is exclusive for Foundation Alliance members, for those that are foundations, and then for support groups. You are the ones that we really want to kind of give seed funding to. So we'll talk a little bit about how your requirements for the grant are slightly different moving forward than our Foundation Alliance members. Again, awards will be determined by a review panel. They have a lot of business savvy. They range from healthcare and disease community activists, not necessarily in the rare disease community, but ones that know how to activate and how to motivate the community. And you'll see here a couple of those pockets of experts that we've brought together for this particular review committee. On to grant eligibility now. I know a couple questions have come in related to this specifically, one of which is what it means to be a support group versus a Foundation Alliance member. So some of the ones under the 501c3s you'll see here, and these are ones that are going to be required to be Foundation Alliance members. And those are things that you can do right on our website. Under the grant program, there's a button to go right to the Foundation Alliance. So if you're not already a partner, it's very simple to do. You go right to the form, enter some information about your organization, and then you're signed up. So again, that if you have questions about that, we'll walk through a little bit of where that is on our website. There's two locations to get it, one of which is under our supporters tab on the left-hand side, and the other is really under our grant program. We pulled that out to make it a little bit easier to find on our website. second kind of bucket of eligible applicants is going to be the U.S.-based support groups. So these people are going to be the ones, and these groups are going to be the ones that have to be endorsed by a medical professional. So what it means is we know that you don't necessarily have the established fiscal capacity or other requirements of a 501c3, but we know that you're doing great work. So what you have to do is you're partnering with medical professionals most likely anyways, and those medical professionals just need to sign a letter saying, yes, these activities we endorse, they are something that will really make an impact of this specific disease community, and then it needs to be on their institutional letterhead. So what it means is if it's a local hospital, that their logo is on the top and it's signed by the actual physician that you're working with. It can be submitted directly to the same website that questions were related to. So that's raregrants@globalgenes.org. Again, that's raregrants@globalgenes.org. And again, that can be submitted prior to your actual application, but it has to be by the deadline of November 30th to qualify that support group from being eligible for the grant. One other note that I want to make for this particular slide is you'll see that it's based in the United States. For this round of funding, we really wanted to be specific to United States-based organizations to ensure that we really had the fund available for one, two, that we had the fiscal capacity to work between different agencies versus going internationally on the first round. This does not mean that we're going to be preventing international groups from applying in the future, but for this first round is limited to United States-based organizations. We're going to go to the types of grants and the size amounts. So I talked about it a little earlier, but range from $500 all the way up to $15,000. And be a variation of that in between. So let's say you apply for $10,000, but the availability of grant funding may be slightly limited. We might decide to give you partial funding if that's the case and that's appropriate. So we will definitely negotiate with different applicants if that becomes the case, but I just want to make you aware that it can be the full or it can be a partial amount, but we will be in communication if that is a difference from the original amount that was applied for. So again, talked about this a little bit when we talked about the funding structure and how this grant really is made possible by our partners and generous funders. But this will be really dependent on the number and size of grants that we get in for actual applicants, as well as the amount that we have available. So it will really be dependent on a couple different factors. Again, to be considered, we have to have you apply online. It's on our website, and again, we have made available a PDF application form so that you can kind of think through what your application will say, just in case there is technical difficulties or something doesn't save properly on your application. You are able to recover your information and don't necessarily put it in on the form the first go around. We recommend that you do it on a Word document or whatever your platform is first, and then go ahead and submit when you feel like it's in the final version. So for the grants that are over $5,000, this will be a secondary piece that we'll cover a little bit more, is going to be the presentation format. So in addition to the application that's online, there is going to be a second component that we will have presentations. So you'll be shortlisted like it says here, and then we'll let you know and work directly with the organization to schedule in early January. Those can range from up to 10 slides max. They need to be submitted at the time of the deadline. So before November 30th, your slides need to be included if you're planning to apply for a grant over $5,000. The presentation itself will last about 15 minutes. 10 minutes of presentation by the organization, and then 5 minutes that allow for the grant review panel to go ahead and ask questions and get any clarifying points that they need from the presenters. So I know a couple people had questions related to that, so I just wanted to clarify that a little bit more explicitly. And again, that can be sent to the same web address, raregrants@globalgenes.org. And again, this is all in the grant guidance, but we really wanted to highlight a couple of these key factors for people. For less than $5,000, you will be going through the review process similarly, but you would not need to have the additional presentation component. So here's a quick overview of just, the next several months. What does that look like? So grants opened on October 15th of 2015, and they will be open until November 30th. You have to have your application online, entered and submitted by 11:59 p.m. on November 30th. If you ever have any technical difficulties or anything like that, please just email us. Any of our team members are happy to help, but raregrants@globalgenes.org will be the website that we'll check very regularly for any kind of technical difficulties or questions, in addition to the ones we've covered here on the webinar. Today is November 2nd. We're going through the grant informational webinar right now. The 30th will be the final application deadline. And then from December 1st until the end of January, that's when the grant review committee will really be deliberating. Be ranging from independent review as well as collective conversations, and then the presentations in early January for those applications that are over $5,000. And then finally, January 31st, 2016, we're going to award the grantees. That'll be the big day for announcements, so stay tuned, and that'll be when you really want to really hone into our emails. So again, this is just another reiteration of some of the important dates. It has a couple additional points for those that will be awarded. So grants that are less than $5,000 will be paid in full 3 days from the time of announcement. For grants that are over $5,000, you will be paid in 2 installments, 3 days from the award, just like the $5,000 or less grants, but then an additional installment will be 3 months following the first payment. One thing I also want to note that we have had a couple questions come in through is the funding and having the personal account. You must have a group organization bank account in that name. This may or may not require a federal identification number, so we definitely want to look into that if you currently don't have a place for that funding to go to. For support groups that may not have a 501c3 designation, this then is another reason why we really want you to be working with a medical professional or another institution, because they can, in fact, be your fiscal agent if that is the setup that you've worked out with your endorsers. So again, just another little point to look into that is a nuance of the grant, but we want to make sure that that's taken care of before we get into the awarding section. So I really have to go over very quickly with the actual grant, but I wanted to kick it off with a couple questions that we've received prior to the actual webinar. One of which is the reporting requirements. So case study was one piece that was a part of the collective framework that a lot of people had questions on. So we wanted to just cover it very quickly and explain that these will be similar to success stories. So capturing information of really what's working with these grants, what's the impact that we're having, and how do you capture that, in pictures and in summaries. And for anyone that's awarded, we will be putting together report requirements. So leading into, the first week of February, all awardees will, in fact, have what they need going into reporting so that they can collect it throughout the year and then leave with a great case study to share with both Global Genes and for your own organizations, because at the end of the day, we want this to be something that really helps support agency move forward. So no worries, that's less intimidating than I think it comes off of. The other one was the slides. So again, we talked about that a little bit earlier today, but I want to reiterate the raregrants@globalgenes.org. This is where your presentation slides go to if you're over $5,000. and it's also where your medical endorser letter goes to as well if you're a support group. And so I've had a couple questions come through, so I'm going to go ahead and reestablish some of these. So give me just 1 second here. I'm going to put myself on mute so you don't have to hear me breathing. Okay, question about the Foundation Alliance sign up. So our website, I'm going to pull it up right now. There is a globalgrants.org/rare-grants/. That's where all of our grant information is. If you move halfway down the page, there's going to be a Foundation Alliance button that you can click on right there, and it'll take you to the form where you can go ahead and sign up. That's pretty quick, and you will have plenty of time, even if you're the day before the grant. We'll get you through the process, so Foundation Alliance members will not be an issue for you. Just make sure to get in a little bit sooner if you can, but if you do need to do it all the way up to the last minute, we will get you through the deadline in time for November 30th. We had several questions about that one specifically. And the slides for your presentation for those requesting over $5,000, those would go to raregrants@globalgenes.org. Good question about international organizations. So if you're based in the United States as a 501c3 but you work internationally, you can apply. It just needs to be based in the United States, and at least 50% of the activities that you you are going to be doing for this particular project need to have beneficiaries in the United States. So you definitely have international with the programs that you're doing, but we just want the organization to be based in the United States. So thank you for that question. The case study, again, we had another question about that. So this, again, is not going to be a case study of your current work. This is a case study really capturing what you'll be doing for the grant itself. So project, let's say you're doing a weekend excursion for your disease community. That would be what you capture as a case study. Who attended? What kind of information can you gather in photos? And a little summary of that. And again, we'll give you complete templates of what that looks like, and we'll be working with you throughout the year to really make sure we can handle that. Another good question about the presentation slides. So one things as far as content, in the grant guidance, it talks a little bit about we don't want you to reiterate the same information. So remember that the grant itself is your kind of establishing what the project is going to be. We want the presentations to really say more about what you are and why, and the kind of impacts beyond what you read on the paper. So again, great question, but again, we want it to be up and beyond what the current paper version is. Okay, so one more reiteration of the website. It is https://globalgenes.org/raregrants/. And I'm going to go ahead and copy and paste that right now right into the chat box for everyone to take down. So please look for that in the chat box right now. And another question came in about archiving of this webinar. Great question. It is being recorded right now. For those people that just want to refer back to it as you complete your applications, it will be on that same website that I just put on the chat box. So our website will house this webinar as well as a summary of the Q&A. So some additional questions have come through, and we've definitely received them, but we'll need a little bit more of an explanation. So we will go ahead and capture all the ones that we've already covered in the Q&A, and then some additional ones. So if your question was not answered during this section, we will be responding to it. We are taking note of all of these, and that will be located on our website. We will, again, when the webinar and Q&A summary is live, we will send an email out to everyone that was registered, as well as our broader community of partners, too. All right, so let's see what else we got here. I think that is really the bulk. I'm going to give you a few minutes just to add any more questions that you have in the Q&A section, and I'm going to double check the chat box, and then beyond that, I think we're good to go, and we really appreciate all the excitement people have had around this grant, and we're equally excited. Okay, one more question about the presentation. Okay, so presentation for those over $5,000. You have a maximum of 10 slides that you can use. They must be submitted prior to November 30th at 11:59 p.m. Pacific Standard Time, that is. And it needs to be sent to raregrants@globalgenes.org. 10 minutes of the presentation will be for the organization to share about their slides and anything else they want to share. 5 minutes will be reserved for the panelists who are on the review committee to ask questions of the organization for any clarifying points that they need. This will be given virtually, either Skype or WebEx, and we'll work with the organization individually during that first week of January to get it scheduled and get all the technology figured out. Good question about the funding being extended of existing projects or totally new project, and that will be one that we do answer in the FAQ, just so we can be very explicit on that particular one. So stay tuned for that. Great question. We really appreciate it. Registration fees. We had a little bit of conversation about that as well, and that will be included in the fiscal part of the FAQ. I will leave the website address raregrants@globalgenes.org, also in the chat section, so that you can ask questions throughout the process. That'll be your main go-to for any questions you have about the application itself, about any technical difficulties you have. We will be looking for that over the next, month to make sure that you get all the answers that you need. And the question was about, can you ask money to give to families to offset the cost of travel to conference? Yes, in fact, that is one thing that can be awarded. To be very specific of what the activities will be, what will the families get out of that? Okay. I'm going to open it up to Carrie and Kim to see if they have any specific questions or if they have any additional feedback. Kim, you're live.
Thank you, Amanda. One thing I did want to note, and Amanda covered it very nicely, just how those presentations will be scheduled and what we're sort of looking for in that 15-minute presentation. Organizations that are based in Southern California, where Global Genes is located, would also have the opportunity to come and present live. We wanted to make that option available to either the foundations that's applying or support groups applying for grants, that if you can't make the travel, of course, that we will use the technology available to us via Skype and WebEx for you to be able to do that. But if you are local, and would like to come in and present in person, we can make arrangements to make that happen too.
To add one more thing, this is Carrie. When considering what you're putting in your application, really stress I can't stress enough the importance of how this is going to affect your community. Really relay in detail how this will impact your community, how you will be able to take those next steps, whether it's support or, like the one that Amanda just mentions about bringing families to your conference so they can get educated. It's just really important that you share that information in your application, because that's really how the team who's going to be reviewing it is going to be able to really figure out what has the best impact based on what you put in. I just wanted to share that little reminder as well.
Carrie, thank you for that, and Kim, the clarification on the in-person option as well. So again, thank you for all your great questions. There's several that are still rolling in now. Let's see if there's any other ones. So a couple of these we're going to address again with our FAQ document that we posted shortly after we get the webinar up and running, or the recording, excuse me. So again, we'll go ahead and answer those that were not answered explicitly on here shortly. And thank you, Kathleen, for saying it was a good webinar. I appreciate that. And again, if you have any other questions, please send it to rare@globalgenes.org, and we will include it in the FAQ document. So if something comes up in the next week and you definitely want to get it answered, we'll include it in the FAQ as we get them in, if it's not already on there. So again, we want this to be a really great process for all of you and want this to be something that is beneficial to the community. So any feedback throughout the process, we're happy to take as well. And we look forward to reviewing all of your great applications, and have a wonderful rest of the day, whether you're in the morning or in the afternoon, as Kim said. And then we'll go ahead and look for applications on November 30th by 11:59 Pacific Standard Time. Thank you.
Thank you.
Thank you.